Hello, I'm Dave Dusso, your host for the Healthcare Insights podcast. We're here to discuss vital issues facing all of us in the healthcare industry. In our current series of podcasts, we've been focusing in on the changing landscapes for payers and the provider networks, discussing topics like Medicare Advantage, ACOs, and other pay-for-performance healthcare models. Our guest today is Steve McCalmont, CEO of Avior Computing. Avior is an innovator in the healthcare informatics sector specializing in analytics and compliance solutions for care quality initiatives. Their customers are some of the largest health plans in the industry. Steve, welcome to the show.
Thanks for having me on, Dave.
Pleasure to have you. Steve, in the changing landscape of healthcare, what are some of the key issues that you see?
The key issues in healthcare today center around cost and care quality and the drive to a pay-for-performance healthcare model. There are major changes going on in the relationship between the health plans and their providers.
Let's talk a little more about this changing relationship.
The change in relationship is becoming much more tightly integrated and interactive. It's changing all the pay-for-performance models like Medicare Advantage all the way up through ACOs.
How does this change in relationship specifically affect providers?
Well, provider outreach is the key to affecting health outcomes. It's really the cornerstone of this overall process. Oliver Wyman did some of the seminal research in this area on how important provider outreach is to care quality performance, specifically in Medicare Advantage. So the big thing we see today is the payers have all the population health data. They have enormous amounts of data. They have to find a really efficient and effective way to digest it and communicate it to the physicians. That's the key to this. It needs to be actionable. It needs to be extremely low abrasion. The health professionals have less and less time to spend with patients, so they can't be overburdened with another set of information. The key is, how do we make this data fit seamlessly into the provider's workflow? They already have a workflow. They already have a way they do their process. This data has to integrate directly into that environment and has to do it flawlessly.
Now, I'm a little confused. Isn't that what portals are supposed to do?
Current generation portals are a good start, but because there's so many of them out there, we're actually starting to see portal fatigue.
So what other strategies have been used in provider outreach?
To date, most of the effort has been centered around manual outreach, and the problem with that is just had limited success. There's been an incredible amount of effort around member outreach, but the issue there is it really hasn't been actionable.
So tell our listeners your vision on improving health outcomes.
Again, provider outreach is really the key focus, but it's very difficult, has some very significant challenges. And we talked a little bit about them before in some of the high abrasion efforts that have happened to date and that don't necessarily fit into the physician's workflows. So at Avior, what we've done is we use really sophisticated analytics and workflow automation to present the exact actionable data to providers in a very, very low touch method. We see this closed loop model of presenting this information as the true cornerstone in improving health outcomes.
Can you give us some examples?
Some great examples are leveraging some of the HEDIS output data, as we're doing in the Medicare Advantage STARS. Here, we take this information in and present data to the provider in a very actionable, very granular form that can directly be embedded into their EMR systems. Because of that, it's directly embedded into their own workflow. The care quality coordinator can pre-screen the tasks in what we call a virtual chart review, and they can complete many of these gaps in care. Oftentimes, there is no increase in physician workload, no tasks outside their normal point-of-care process do they have to undertake. This ability to consolidate and manage care quality initiatives is very helpful in lowering the workload of the healthcare professionals. Care quality programs based on HEDIS metrics. In this case, with sophisticated analytics, one task can possibly satisfy multiple initiatives, further reducing the workloads of the healthcare professionals. Dave, it really comes back to that whole portal fatigue and provider abrasion being the critical resistance points that what we've done is overcome them through very sophisticated analytics.
Are there other applications for some of these analytics-driven methods?
Dave, there's multiple applications for these methods. Some of the examples can be proper diagnosis of hierarchical chronic conditions. Getting the proper documentation from the providers to the payers really affects the appropriate premiums, as in Medicare. High-risk meds is another area. The side effects and cost of management is very significant in the healthcare space today. Those are just a couple examples of how care quality initiatives can be positively affected by analytics and proper workflow automation.
We hear a lot about big data these days. How do you see this impacting care quality?
That's a great question. Big data, as you know, is all over the news today. But it really starts with leveraging some of the advances in population health information and care quality data. A lot of extremely exciting things are going on in population health with some of the population health companies like MedAI, Optum, and some early stage organizations doing some outstanding work like Predilytics. As an example, they can dynamically optimize your view of population health in almost real time, and that's kind of turning the population health world upside down. But again, back to the big data question. The data is approaching the volume, velocity, and variety that we classically categorize as big data. And presenting all that data to providers in an actionable form and to fit their current workflows is a very daunting task. At Avior, what we do is we again bring it down to the level of granularity of what we call the 3 Ps: by provider, by patient, by procedure. And that's critical to getting this information to be actionable and usable. Just going out and presenting reams of data isn't a job aid. The information has to be compressed and reduced to its smallest actionable unit via analytics. As an example, specific gaps in care by patient, by procedure. That is the key to taking all this big data and making it useful.
What I'm hearing is that these basic parameters cover many care quality initiatives. What is Avior's position on this?
Yeah, absolutely, Dave. These can cover many care quality initiatives. But we suggest that health plans focus on getting the automated provider outreach initiated on a well-defined initiative, focus on that and optimize it. It needs to be architected overall so that other care quality initiatives can be seamlessly added to it once the outreach method has been optimized. It's kind of that old adage about eating the elephant. You have to do it one bite at a time. But if you do, and you start adding multiple initiatives on, this model can save an enormous amount of costs, increase care quality. In the case of Medicare Advantage, it can increase your quality bonus payments. It's really good for everyone.
It's all really fascinating. Is there any place that healthcare professionals can go to get more information on these very important issues?
Yeah, sure. I just had an article published in Healthcare IT Analytics. It's called the 7 Health IT Questions to Improve Pay for Performance. It's on our website at avior.com. That's avior.com. And it's a really good blueprint of all the things that we've talked about today. It's really kind of a nice outline of this methodology.
Hey, thanks, Steve. Really fascinating. Thanks for being on the show.
Dave, thanks for having me on.
And thanks to all our listeners. For Healthcare Insights, I'm your host, Dave Dussault.